So as a neurologist, but also a brain scientist, I think it is increasingly clear that there is an important interaction between what's happening in our brain, our body, and how also related to sport, performance, traumatic brain injury, concussion. My job is more than just making a diagnosis and prescribing pills or interventions. I think we can and should give a more central, active role to athletes, to citizens, because one thing leads to another. We study, for example, both in our unit in Belgium as in Canada, the impact of sleep and how we deal with stress and how that impacts anxiety, depression, cognitive function, even at the level of our immune system. That interaction is complex but very real. So I'm very happy that this conference is going to share the latest insights and presenting guidelines, of course, to make sure we prevent injuries and discuss new ways to treat post-concussion syndrome, and of course invite everyone to just benefit from the positive effect of sport on the brain and body. Within our academic centers at the University of Liège, University Laval, Cerveau Brain Center in Canada, we are, I think, leading in the field of neuromodulation, that being using magnets, magnetic stimulation, or electric stimulation we call TMS, transcranial magnetic stimulation, or TDCS and variants, transcranial direct current stimulation or alternating current, to basically stimulate neuroplasticity. So the brain is billions of brain cells, neurons, but more importantly, thousands of billions of brain connections, synapses. And so when one suffers from a concussion, these little bridges, connections, are being disturbed through the traumatic impact. And well, the brain is a very powerful but also fragile organ, and when you shake it, you break it. So through neuromodulation, we can stimulate part of those networks that are critical for cognition, for mood disorders, and help patients. And there is increasing evidence from clinical trials. And the challenge, of course, is now to offer that to athletes, which is what we're able to do in Antwerp with Trainum and Brainum. And I'm very happy that there's more and more interest from both academic hospitals and centers all over Europe who are starting to implement those new neuromodulation therapies to the rest of the treatment. Because, of course, this is not a magic stick. This is complementary to the rest. Pharmacological treatment, if needed, psychotherapy and neuropsychological coaching, and the importance of, as we said, lifestyle. So making sure that there is good quality sleep, and that athletes or people who are suffering from a traumatic brain injury, concussion, do not start too early, and that for top athletes can be a challenge. So neuromodulation, I think, is very promising, and we see increasing evidence that it can help, but it's not a standalone. It's really complementary to the rest of our therapeutic approaches. It's difficult to share individual stories, and many of these top athletes do not necessarily like us to share these stories. So we have soccer players, cyclists, professional cyclists, or rugby players, or um, different top athletes who struggle for weeks, sometimes months. And I think that neuromodulation can bring a new dynamic. So this is definitely part of the multidisciplinary approach, where we have very positive feedback. And well, I hope that one of these athletes will also accept to share the story, because there still is some kind of stigma. When I'm a top athlete and I suffer a concussion, I I kind of want to hide, and sometimes pretend I'm doing better than actually things are, because there's so much money involved, and it's for an athlete easier, well, to break a leg, or some injury that is visible. When I come to training, and I'm clearly having an injury that is visible, it's more acceptable. When I suffer a concussion, you don't necessarily see anything. I would just feel dizzy and fatigued and have concentration problems, headaches. So there is this tendency to, well, maybe hide or pretend to be strong, which is this athlete's mindset: no pain, no gain. And for post concussion syndrome, that can be an issue, because when we try to do too much too quickly, and I've seen it in many cases, then we run into trouble. So, of course, for specific stories, I know many. I can share very few, but I do hope that we will have athletes who um, come out of the closet and share their experience, because by doing so they will inspire, especially the young generation, where I think that despite the wonderful guidelines, still a lot of more effort is needed to translate that to the reality of the players, both amateur and, of course, professional. So I think it's important that through conferences like this one, we talk about it. Definitely, young athletes should be aware about the importance to protect what is, I think, the most important: your brain. And of course, each and every sport has different challenges. It will be different for boxing, martial arts, as for soccer, rugby, cycling. But it needs to be evidence, but it needs to be obvious that one puts on a helmet. And we see, just as wearing a safety belt in the car, this is now generally accepted, where it was different, um, well, a couple of decades ago. So truly, I think we have been neglecting the importance of protecting the brain. We would see players protecting, well, their genitals, or their teeth, or their legs, depending on the sport. Uh, and of course, it's very strange that what matters most now, knowing that concussion truly is more than just the direct impact. One can lose consciousness, one can feel dizzy, have memory problems. But we also know, and this is very important, that decades later, this can lead to neurodegenerative disease, that there is an increased risk for dementia, for Parkinson's. And that is kind of a silent epidemic. We don't see it directly, and sometimes we want to, well, not really know that part of the story. So again, it's through information, through improving the guidelines, and through making sure that when, and this of course can always happen, when one is doing sport, you get a concussion, a traumatic brain injury, you know what to do, and you're taken care of, and you're putting your brain in the best possible condition to heal. Because we have no kind of miracle drugs to cure traumatic brain injury. So this is putting the brain in the best conditions, and through, of course, neuromodulation, we can help, but still prevention and knowing that a concussion is, having an impact, both direct and years or decades later. I think that is very important, and that is why I'm so happy this conference is being held, and we'll see more, of course, of the impact of informing, especially the younger generation of athletes, so that we can make sport not only healthy for your body, but also not exposing you to risks for healthy aging and a healthy brain. So it's very important that dealing with traumatic brain injury, with post-concussion syndrome, is not the field of expertise of one doctor or expert. This requires a team. So together with the athlete, with the patient, we will work together. So there's the role of the physiotherapist. Very often also there will be a muscular component, the ENT specialist. We need to understand better dizziness, and exclude that there's a problem in specific equilibrium organs. We need neurologists, we need a GP, we need psychologists, neuropsychologists, speech therapists, depending on what's happening. And then, of course, the interaction with the patient, who is not just passively undergoing things. It is clear that it is the combination of all these approaches that will be able to help deal better with post-concussion syndromes. And that is also true in the field of research. So we see that understanding neuroplasticity and how the brain deals with the impact of trauma requires the working together of many, many areas. It's increasingly clear that we now benefit from AI. So we have informaticians, top engineers who can deal with these big brain data sets, because we now can understand better the progression of the disease through very sophisticated brain imaging, measuring also the electrical activity of the brain. And that clearly is a multidisciplinary effort, both scientifically as its clinical translation. The take-home message is that we need to talk about the importance of traumatic brain injury, that concussion is important to recognize as early as possible, not necessarily involves loss of consciousness, that it is different from other injuries in a sense that top athletes sometimes want to go further out of their comfort zone. This no pain, no gain philosophy doesn't work for concussion. You need to learn to listen to your body and the symptoms, and that's only the athlete, the patient, her or himself. And concussion needs time. So please do give the time to let your brain heal. Do not go too quickly. back to training too quickly, back to competition, because that's when it can go wrong, when you can suffer for months, sometimes even years. And then, of course, prevention is the best medicine. So that all together, we try to think, how can we enjoy sport and make it safer for the brain? And I see wonderful initiatives. We will here discuss the guidelines, but we also need to make sure that they're applied everywhere. And there, I would say, still is room for improvement. So, talking about this, raising public awareness, both for the people doing sports, the families, for the children, I think that is very important, and I'm very, very happy, therefore, with the wonderful program that you've put together here.